Okay, this video is a book review of a book called Radical Remission. And Radical Remission, the author's name is Kelly Turner, PhD. The copyright on this book is 2014. And it's a good book. She was graduated from Harvard. Then she went and worked at a cancer center. And, one of her relatives died of cancer, and she had another person she knew who had cancer. So she was very personally taken up in it. And then she met a person who survived metastatic cancer. She got all excited. She wanted to tell all these other people about it, and no one seemed to care. And she's like, what is wrong with you? How could you not be excited about a person surviving metastatic cancer? And even some of the doctors told her, oh, don't even tell other patients about this. You just give them a false hope. And she thought that was ridiculous, so she started studying cancer patients who survived metastasis. And she called them spontaneous remission patients. And these were people who had outlived, let's say, 25% survival prognosis prediction for 5 years, and who lived significantly beyond that, who had significantly outdone expectations. And she wanted to see what did they have in common. And she looked up a whole bunch of case reports of patients who had survived aggressive cancers, and she also went and interviewed a whole bunch of them. For her PhD dissertation, she interviewed 20 radical remission patients, so she called them radical remissions. And she was shocked that no one else was excited about studying this. So she went and interviewed about 100 of them, and she read all about the case reports, and she wrote this book. So I think the book is good. She's kind of young when she first wrote this. She doesn't have like a deep knowledge of biochemistry, nutrition, pathophysiology, and all that stuff, but her heart's in the right place. And when you seek the truth and you're willing to correct when you make mistakes, you work towards it, okay? So she listed like 9 of the things they did. They all optimized their diet, which primarily meant, of course, low-fat, low-sodium, vegan, eating especially organic, not always organic, but trying to strive in that direction. Also important to have a water filter. There's a lot of junk in the water. So she's on top of all that, avoiding sweets, refined processed food. That's all good. Eating more fruits and vegetables. Their fruits are low in methionine, good. Low in protein, good. Low in fat, good. She was aware, it seems, of T. Colin Campbell's data on avoiding dairy with all the casein. So that was all good. Oh, what else did she say? You have to take charge of your health as a patient. You're not just a passive person who sits there and only can do what your doctor tells you. You also have to do things to help yourself. Trust your intuition. If something sounds bogus, it probably is. Double check it. Try to increase the positive emotions in your life, the social support, the religion. Have a strong reason for living, something that you're excited about. That really energizes a person and makes them more resilient. So she's very good on all the psychology stuff. Okay, so what do I get from the book? If I had to summarize 2 key points, number 1, we talked about the diet. That's a big theme of ours. Number 2, put yourself and spend more time in parasympathetic autonomic nervous system, which means the relaxed phase of life. So there's really the SANS, sympathetic, and PANS, parasympathetic phases of life. Spend more time in PANS. Low stress, rest and digest, feed and breed, all that kind of stuff. Let go of your resentments. Enjoy the happy moments in life when you can. Have a purpose, all this stuff. We talked about that. All radical remission patients took charge of their own care. They listened and learned from their healthcare providers, but they didn't automatically go along with what they said if it didn't make sense to them, if it didn't pan out. My advice would be, if something's recommended to you, go read about it yourself. Get a second opinion if you can. There was talk about psychological blockages. Yeah, and in a way, too, I think it's kind of funny, but it's true. The meat-eating diet blocks you up in multiple areas. It plugs up your arteries with atherosclerosis. It plugs up your butt with constipation from the lack of fiber. It plugs up your kidney tubules with all the calcium coming from the excessive sodium chloride-related calcium loss and all the acidic animal protein amino acids-related calcium loss and caffeine-related calcium loss. Okay, psychological stress increases calcium excretion in the urine too. Meat's probably the biggest one there though. Blood flow, and then regrets and resentments. Yeah, you want to let that stuff go. Don't waste your time with it. It's sort of like the serenity prayer. I will make the most of the things I can influence, and I'll just let go of the things that I cannot influence. Let's see. Synchronize your physical, emotional, and spiritual self. Yeah, I like that idea. Basically, if you know who you are, and what you want to accomplish in your life, and you're sort of aligned, like your conscious mind, your subconscious mind, if you will, you can function more effectively. That's why I think, I like that Anne Ryan quote. You can't get away from philosophy. You either develop your own personal philosophy of how you're going to live your life. Your religion, of course, influences that, the people you care about and all that. But if you don't make an effort to do that, you're just going to be passive, conformist idiot, most likely, who sort of just goes by whatever is trendy at the moment in your society. Okay, she talks then about what's called sort of the conflict between Pasteur, the idea of the problem is the bacteria, we must aggressively treat it, versus sort of the Béchamp philosophy of it's the terrain, we must improve our overall health, our immune system function, and it will take care of the cancer. I agree to a large extent with that. If you optimize your health and your immune system, it'll prevent almost all cancer, and that includes optimizing your diet. Is there a guarantee? No, but are the odds better that way? I believe so. Let's see. All right, so... Oh, also, she knows Chris Wark. Chris Wark knows her. I think they're both good. I like Chris Wark. It was a while ago when I read his book on cancer. It's quite good. And I like some of the things he has to say. This is Chris Wark now. And so he sort of knows Kelly Turner, and he recommends her book. I do too. I think it's a good book. It's worth your time. There's an audio CD version of it. So it's pleasant to listen to stuff in the car and then double check the paper version for stuff you're curious about. He talks about having a serve first mentality. He says... And here's what I like. This is the correct attitude, I think, for getting better from any disease and for being successful at most things in life. Some people have beaten cancer. Why can't I? Why can't I? Why not me? And when you chase a goal like that, you'll get good results. Forgive other people for your own sake. You don't want to waste time and stress on them. Raw food satisfies hunger with fewer calories, takes more effort to eat. Ask yourself, will this cure my cancer? Not will I have a response. A response doesn't really mean that much. Will it cure my cancer? What are the odds? That's what you want to know. Will it help to cure? Does this add up positively for my prognosis? How much? Persons who are chronically socially isolated and lonely, worse prognosis. We kind of covered that in my distress cause cancer. Kelly Turner, that's KT, her initials. She talks about having a purpose. Your body listens to what the mind tells it. Right. So get your attitude straight. Attitude of gratitude. See the positive in a situation. So anyways, it's a good book. And the book itself goes into a lot more detail, of course, than what I'm doing here with this review. I like the psychology of some of the patients. Like a guy would, if you've got a blood tumor marker, you could follow that blood tumor marker to see how you're doing. Check it a little more often, like a prostate PSA. You do something and the PSAs seem to be trending up. Stop doing that. The PSAs seem to be trending down. Maybe that's a good thing to do if it's related. So anyways, Radical Remission by Kelly Turner. Good book, worth reading.